As you know, we've been trying to tell you everything we know as we know it, and I've given a series of little science lectures, so to speak, to try my very best to translate this as a doctor to my patients, which is the 11.7 million people of Ohio. My team's putting together the past press conferences we've had and snippets from that, because I can't start from the beginning and take us all there today. But I'm going to give you a few things that I want you to keep in mind, go over again why our healthcare system not being overwhelmed is so vitally important, and I'm going to talk a little bit about how every day and every one of us and what we do matters, and try to give a little bit of guidance for the folks, what you can do at home and what we need to do for the most vulnerable among us. So starting with what we know today, it is getting increasingly hard to give you numbers that are accurate because it's pouring in so quickly. We have data from our labs. We're still awaiting some of the private data, but I'll give you what we knew as of 2 p.m. We do know that we have 36 positive cases and at least 350 pending people under investigation, and that's just in our lab. The illness onset is from February 7th through March 13th. And I want to pause there for 1 second and say, this is absolutely important for everyone in this country to understand. I saw Dr. Fauci, Dr. Gottlieb on the news today trying to explain this to people. And I've said this before, cases can be very misleading to the public because it's a past historical event. Because of our lack of testing, cases are just the tip of the iceberg. And in reality, it's not the numbers of people you have, the numbers going around. We will not have an accurate picture of that. We'll never know accurately who all, but we'll get closer as we look back in history on this. But it's not, the cases are the tip of the iceberg. There are many cases out there that are undetected. And more importantly, there are many asymptomatic people. Each and every one of us must suspect that we could have it or be carrying it. But you can be asymptomatic and your symptoms will not show for at least 5 to 6 days, if not 14 days from now. It is, like I said about the starlight, we're seeing the light in history of light years, and that is what you are seeing cases. So we are looking at what the scientists know, what we're seeing happening in other countries, what the best data and studies are, and we're predicting based on that. But be assured, it's already amongst us. And in fact, the fact that one of our cases started in February 7th, having their first symptoms, means that they were infectious long before that, up to 14 days before February 7th, but certainly at least 5 to 6 before they started showing those symptoms. And then they probably thought, like most of us probably did back in February, that we had a cold or perhaps the flu and lived through it. And that's amongst all of us here in Ohio. You have to understand that by the time you're infected and you do not know it, it will be another 2 weeks, and this is Hopkins research, 2 weeks before you will actually be hospitalized from this. It's really from that first onset of infection when you didn't know you have it to you are in the ICU is 2.5 weeks. And deaths are going to occur 4 to 6 weeks after that. So that is why we have to just assume right now what is here, and our data is increasingly showing that. Our age ranges, 31 years of age to 86 years of age, with a median age, again, of 53 years. We have 13 females and 23 males, 11 hospitalized. Multiple counties, and our county data is going to lag our understanding. I'm getting a lot of reports from a lot of cities that have been told they have a case. But unfortunately, because most of our testing is sequestered in the hospital centers, often in the big 3 Cs here in Ohio, sometimes they're putting down where they tested and not the county a person lives in. But as of right now, we have 11 counties that we have accounted for. Belmont, Butler, Cuyahoga, Franklin, Lorain, Lucas, Medina, Stark, Summit, Trumbull, and Tuscarawas. And I know for a fact that some of that has not been included yet. So, timing is everything and every day matters. All of this is about the hospital surge that you're hearing about. It's about what I believe Newt Gingrich just wrote about today, what he's seeing on the ground in Italy, saying we have to act like this is a war. It's a war on a virus. And you're seeing unprecedented measures in places like France and Italy. Italy, the closing of churches, even for individual prayer, has never been done, even in the Black Plague. You're seeing stresses on systems that have modern healthcare systems, taking the actions we're taking. The blessing we have is that every day we do more, we are going to blunt that curve. But we are in the surge. And as the governor said, the places, Wuhan was one city under a surge. It was one point because it was where it originated. They didn't have time to put our non-pharmacologic interventions, these things that we're doing to enforce the social distancing that is so essential. So they saw that spike, and every day and everything we do in this country, and this is from, again, Dr. Fauci, Dr. Gottlieb, the folks that were out there in the news that are saying this, everything we're doing is trying to slow the spread that we know is coming and decrease that surge on our hospital system. It is a lot like a hurricane. I've said this before as well. You want to evacuate and make your moves, and if you're blessed enough to see this tidal wave coming, this tsunami coming, you make these moves now, and every day decreases that exponential 2 to 3 people spread that creates the surge. We are in the time of evacuating from a hurricane where it's starting to pour more and more heavily with each day. We don't want to be doing these moves in the heat of the storm. And I can tell you, Ohio is prepared, they're preparing, our hospitals are preparing, but I want to give you some of the data. We'll talk a lot more about the surge tomorrow. Just some statistics that we have as of now, and my staff will give you the sources of these. In a moderate COVID-19 outbreak, as it hits the United States, and I'll say one more point, we likely won't have one city. We'll have surges in cities first, but we're going to have multiple Wuhans in this country because it had already spread in our country. It didn't start at that point of origin. So you'll see this in places all over the country. We know from the first estimates that 200,000 ICU beds will be needed in the U.S. 45,000 ICU beds are available, and many of them are already occupied at 60 to 80% occupancy. We know that we have approximately 160,000 ventilators available. I heard Dr. Gottlieb use words this morning. We have 60,000 of the full-service ventilators, another 100,000 ventilators that aren't this, they're more mechanical, old-school type ventilators. We have in stockpile, I've heard some numbers, Dr. Gottlieb said 8,900 of the full service. I've heard 10 to 20,000. If we don't make these measures, and remember, this is key because people keep taking these numbers, if we do these measures now, we will greatly decrease the need for these. That's why it's so important. So the actions we take now will have an effect in mitigating these kinds of numbers. But if we delayed mitigation, an original estimate of an influenza of 1918 would be you would need 740,000 ventilators. So that's why the things we do matter, because we're trying to keep within the scope of what we have. You're going to see unprecedented measures by hospitals set up here. They're going to be doing more of what we said. We're going to be stopping all elective surgeries. They're going to be sending people who aren't as acute home. But much more important, I think people at home don't understand. It's very easy to think, especially when you're healthy right now, especially when it's just trickling that rain, that, you know, I'm invincible, I'm not going to need this. But the fact is, not only do we need this, for our most vulnerable, so many people in our country have pre-existing conditions of heart disease, diabetes, all sorts of healthcare needs, who are being treated for cancer and on immunocompromising drugs, including our children, who we know get sick as much of us, don't get as badly sick, but some of our kids will get sick and some of our kids will die. And the ones who have pre-existing conditions more so, but they most certainly are infected as much as we are. But this is it, when our hospital systems are overwhelmed, that means if you're having a birth that you are planning, if you are in a car accident and need your hospital, if you have a stroke or an MI, even if you never get coronavirus, people in this country could die from something other than coronavirus. It's so important. These actions we take individually are going to keep our nurses from getting sick. You're going to hear a lot about bed capacity. It's not about beds. Our national, our National Guard and others will be setting up tents and things with beds. We need nurses and doctors. We need firefighters and EMS and people to not be sick right now. And every one of us might be infecting our neighbor who is a nurse, who we need during this response. This is a civic duty to keep those folks safe too. We know already of a firefighter who is one of our cases. That means that firefighter was sick for asymptomatic 6 to 14 days. That means that entire house of firefighters has been exposed and might need to stay home for 14 days. Now we don't have a fire station up and going. We saw this in Washington already from those first responders. So all of these ripple effects matter. And these proven strategies, we have talked to the scientists who have invented these strategies. They were in the footnotes of the governor's curve on that 1918 data. What they are saying is, and what Dr. Fauci said today is, we need to do all of this, and every day and every one of us matters. Young people, I had my first night at home with my husband, and my daughter was home. She's 23 or 4. I'm miscalculating that today as I stand here. Maddie, sorry. She and her friends were talking about, do we go out tonight? We should not be going to restaurants. Now, no, we rely on restaurants. 50% of us get our food from them now, and that's why the carry-out and delivery is still so needed, because we need that, because there's so much pressure on our stores right now. But if it is not essential, you should not be doing it. And young people, you're part of this, absolutely part of what I'm talking about. And we'll have more communications on how you can help during this, because we're going to need your help as well. This is disproportionately going to hit the most vulnerable amongst us. There is no doubt of that. We've predicted this all along. All over this state, philanthropies and nonprofits are working tirelessly. We're going to work on the needs of the homeless population. We're going to work on all of this. And these policies will layer on day after day. We won't have them all in the big day, but the state of Ohio has moved all the big rocks, the most important breaks we can put on spread, and we'll keep layering those on day by day. And as the Lieutenant Governor will share with you, we will keep building supports. But please know, everyone, this is the real thing. This is not a drill. This is the once-in-a-lifetime pandemic. And everything each of us does matters.